All right, well, good afternoon, and thank you for the opportunity to discuss low submuscular reservoir placement with TFF. So here are my disclosures. I do consult for companies that make products, ED products, including Boston Scientific. So let's be honest, when you place an IPP reservoir, you have a lot of options where you can place that reservoir. It tends to be one of those concerning parts of the procedure for many implanters. Today, I'd like to talk about the low submuscular placement with TFF. In 2010, the reservoirs became flat, and there was a huge advantage to that because the diameter was only 2.5 centimeters. They were much more easily concealed, and that's where you saw a significant increase in low ectopic reservoir placement. The problem was that a lot of these reservoirs were herniating. So in 2013, Al Morey popularized the high submuscular placement. When you place that reservoir high submuscular, less chance for herniation as well. But there are complications with the high submuscular placement. Higher chance for visibility, intraperitoneal placement, colonic injury, inferior epigastric artery injury, and you still get the herniation and the migration. So in 2020, we started performing the low submuscular placement with TFF. If you remember the anatomy, the muscle is thickest in the middle and it gets thin laterally. So essentially what you're looking for is to place a reservoir submuscular medially and not so high up to get better concealment. This is a very simple procedure. Essentially what you do is you place an S retractor into the external ring, you place a right angle from the outside into the ring, you grab the tubing, and then you put the reservoir under the muscle in a low submuscular fashion. So here's just a video showing this. Usually you just put the finger into the ring, past the right angle, grab the tubing. It doesn't matter if you go from the lateral or the medial aspect. And then as you bring it through, you literally lock it in, and there's essentially a 0% chance of herniation because you fixated the tubing through the fascia. Then you're able to then pass the reservoir below the muscle. So again, there's also almost a 0 chance for migration as well because you fixated the tubing. So in our earlier series of 31 cases, 31% of patients said they could feel the reservoir, and that's not surprising if you press down. None of the patients reported bothered by the reservoir, no revisions. Overall satisfaction was quite high, and as you expect, there's no herniation or migration. We had no complications. What's the advantage of the TFF with low submuscular placement? It's safe, it doesn't take much time, no risk for reservoir herniation or migration, and if you're going to do a revision and you have to find that reservoir, it's extremely easy to get that reservoir back. So in conclusion, you have a lot of options where you want to place this reservoir, but I would say that the low submuscular transfascial fixation seems to be safe, effective, with minimal complications. Thank you for your attention.